So, thank you, Anne-Marie, for spending some time with me today. I really appreciate it. I know you're incredibly busy. Can you start by just telling me a little bit about your background and also what the role of this, because this is a new position, I believe, a new office.
It is, yeah. Thank you. Thank you for making the time to speak with me. It's always great to meet people who are involved in the coalface and doing things for people and patients, so I really welcome the opportunity to be connected to frontline service delivery. So the role of Chief Allied Health Officer has actually, it's been in the Commonwealth since about 2013,
Right.
but it's been attached to a Deputy Secretary position, and they are incredibly busy. And so the role in its current form is new. I started on the 1st of July as the Chief Allied Health Officer, and I have responsibility for allied health and also the interface between health and disability, and some other responsibilities as well. So it's a very broad portfolio, but the reason it was created was to give some more profile and prominence to allied health and its importance to improving the health and well-being of people in Australia. So it's great.
Fantastic. Now, you're a doctor. Excuse my ignorance. Is that a PhD or is it a medical or both? Or
It's a PhD.
Right. And what's that in?
So I did my PhD looking at how Australia got its Medicare system.
Ah, okay.
Yeah, which was great.
Yeah.
I loved it.
Fantastic. Well, the Medicare system, as I understand it, it's recognised around the world as being gold standard and often used as a model for other countries. So obviously have a very in-depth knowledge of that. You mentioned interface between your role in NDIS, or I'm assuming NDIS. How does that work? Because in the fitness sector, we have a lot of clients with disabilities. Some of our personal trainers get access to plans that might come under the NDIS or NDIA model, etc. Some don't, some can, some can't. Some can use their plans to attend a gym, some can't, depending on how it's all worked, whether it's been managed by the NDIA, I think, or being self-managed. How does it work from your sort of perception?
Yeah, so again, there's a lot of crossover between the role of health and disability.
Yeah.
We are the Commonwealth Department of Health, so our focus is on ensuring that all people in Australia have access to the best health services and achieve the best outcomes for them. That includes people with disability. The NDIS is obviously a separate scheme run by a separate department, and they have certain responsibilities as well. So there is an area, I think, where there's a bit of overlap, and that's something that all of the relevant departments are starting to work through in a bit more detail now to make sure that people get exactly what they need. So there's people that are in the NDIS that are using gyms, and I was just talking to you beforehand about a fantastic story from a local gym down here where the manager was providing fantastic care to a range of people with disabilities, and it makes such a huge difference to them. But there's people outside the NDIS as well that have disabilities that are also being supported in a whole range of different ways. So it is a complex system, and the way governments work and the areas of overlap. There are some issues to work through, but governments are really committed to working through those over time so that people get the best services that they can.
And look, full credit to Club Lime. Let's name them,
absolutely.
Because that's the gym that you were mentioning.
Yeah.
It's an interesting situation. The gym I was attending in Victoria had a lot of people with disability come, but the manager down there and the staff were really good because they were pre-briefed on the behavioural patterns of the clients coming in. They were able to then work with other customers or clients who were in the gym when these clients came in. And I have a little bit of a background in autism, and so I know how people with autism, particularly high-level autism, behave. And it was really good because it didn't actually throw anyone off kilter. People accepted them, they were welcome, people watching out for them, not just the exercise professional staff, but also other gym members. And it was a really good sense of community where people were looking after each other, and to see these people with disabilities being able to achieve fantastic things, not just even taking into account the disability, but just in general, I found it incredibly uplifting to see these people out there pushing their own limits and being part of the wider community. So any gym members or gym businesses that are listening, please welcome people with disabilities because they can achieve just as much as anybody else can, obviously.
Absolutely, and a lot of people with disabilities do have support systems. So if people don't feel confident, it is just about being connected to those people around them, the support systems and the support people who can provide the advice and the information you need to then be able to work with that client in a really positive way. So it's a great role that people in who are working in gyms can fulfil. It's satisfying for everyone, I think.
Yeah, and I mean, it's not just people working in gyms, it's also our personal trainers that run outdoor programs, one-on-one training, etc. So there's a huge benefit and just fantastic outcomes. So you've been in the role for 4 months, roughly?
Yep.
You obviously were given some tasks or some priorities in the first 12 months. Can you share any of those with us at all?
Yeah, sure. So there's a few. In a general sense, it's to try and strengthen the connections that the Commonwealth Government has to the allied health sector. It is very broad, it is very diverse. The Commonwealth doesn't employ people directly in terms of health professionals, and we don't deliver services. So it takes us, some other ways to connect with the vast range of people who are working in the health sector. So that's something that my role has been created to do. So that's a two-way street. So it's receiving information from people on the ground about what's happening, what are the issues, what can we work together on, but also making sure important information about government initiatives is passed on to the community as well. So that's part of the role. The other one is raising the profile of allied health. We know that there's lots of people working in allied health that do amazing things for people, but the general community is sometimes less aware of that. So having a Commonwealth Allied Health Officer is one way of increasing the profile. And I work very closely with my state and territory counterparts. They have chief allied health officers in each state and territory.
Right.
So I work very closely with them at Great Group. And so together we're trying to raise the profile of allied health. So there's some general things. Specifically though, the government is working on a 10-year primary care plan, and allied health has a strong role in that. So I'm working with various people from the department and across the sector to make sure that allied health is considered in thinking about that 10-year primary care plan. And I also have quite a strong interest in rural and remote health, and I've been working really closely with the new Rural Health Commissioner as well on how we can make sure that allied health services are accessible to people living in rural and remote areas. So there are a few things. The other priority is, I guess, COVID has been everybody's priority, and making sure we respond to COVID. And then finally, something that's really becoming an emerging issue is looking at digital health and connecting allied health to other parts of the health system as well. I think if people are better connected, it makes it much easier for information to be shared and for people who are receiving services to get really high quality services.
And you mentioned at the start of that answer that allied health is a little bit not lost, because the community is often confused about what is allied health, what makes up allied health, what other professions are involved in. Why do you actually think that might be? You'd like to say it's because it's emerging, but it's not. No.
I mean, they've been around for a long time. So I think partly it's because it's so diverse. There are so many allied health professionals, and people might have interacted with one that they know it as, the dietitian or the exercise physiologist. They don't know the broad term. And so I think it's because it's so diverse that people don't recognise the term in some ways. And also, there's a lot of focus, even if you just watch television shows, there's focus on doctors and nurses. That's how they portray...
People in white coats.
Yeah, people, I mean, even that's not a portrayal of reality.
No.
But it's a bit of a stereotype, and that's what's reinforced a lot of the time as well. So it's just an education thing. It takes a long time. I think as younger generations come through, then they have experiences where they see a lot of health professionals, a broad range. They're more educated about it, but it will take a long time, I think, for that broader recognition of the role of allied health and what it encompasses as well.
It's interesting you say that it's going to take a while for that broader recognition, because I think that applies equally to the fitness sector to some degree, and you mentioned exercise physiologists. We have a large number of exercise physiologists working as personal trainers, exercise professionals in our sector. And allied health, as I understand it, in Australia is normally considered an essential service. Gyms aren't here in Australia. I was saying beforehand that they have just almost achieved that status in the UK during COVID, which is fantastic. But why do you think, or do you have any views on why the fitness sector has been sort of, I guess, marginalised from the allied health? Because with exercise physiologists, there's clearly a very smooth overlap there, and yet in health funds' minds, in governments' minds, and I don't want to put you on the spot here, but just generally, have you got any observations or thoughts about why that may be?
I think it sort of goes back to my answer before about diversity. You know, it's much easier to make decisions when things are clear-cut and straight. When there's a diversity of people working in a sector or in a setting, it becomes harder to make a clear-cut decision. And I think, you know, the fitness industry probably falls into that category. You know, it's easy to make decisions about hospitals, because we know who work in hospitals. And, you know, we've got a lot of control over those. So I think the diversity is probably, it makes it more challenging.
What about, I mean, as I understand it, I might be wrong on this, but everyone working in allied health would have a qualification of some type, I'm assuming, and quite possibly a tertiary qualification. Would that be one of the issues, do you think, that could be just demarcation?
So, I mean, governments tend to define allied health services as those that have a tertiary qualification. Different governments have different definitions of who is included as an allied health professional. So that's, again, adds to the complexity and the diversity as well. So even, and they have different definitions depending on a different program or the different settings. So it's messy.
Yeah.
And I think, you know, messy, complexity, diversity, it makes it harder to make clear-cut decisions.
Every profession that I'm aware of, and I was a teacher by trade before I moved on from that, but every profession I'm aware of that has credibility and recognition usually involves ongoing professional development or ongoing education, whatever it is. In the fitness sector, members of Fitness Australia have to do 20 credits per year or per membership period. There's no requirement in Australia to register with any exercise body, so people can practice without registration to anybody. There's other registering bodies that don't require professional development, ongoing training. Do you have a view on that and where that may sort of influence thinking and people's perceptions as well?
Yeah. Look, I mean, I can only strongly encourage a move towards ongoing professional development and training. I think absolutely. People, you know, as people are consumers, you know, and they like to be assured of the quality of the services. Increasingly, people are looking for that information on websites, endorsements, and, you know, qualifications, all of those kind of things. People are much more savvy consumers than they were 20, 30 years ago.
Yep.
So they know how to look for that stuff.
Yep.
And I did have a look at your website, and you have some fantastic stuff in there. Code of ethics, advice to the sector, guidelines, all of those, you know, documents and material is really, really valuable. And I think the push to have some kind of system where a consumer can know that this person or this gym or this setting or this business is providing high quality care is absolutely the way to go.
I think you've segued into my next question with that answer in a way. We're about to start literally next week a survey of the sector to just check out the appetite for the introduction of some form of regulatory framework, because at the moment we aren't regulated. We operate basically under the Code of Practice if they're members of Fitness Australia, Code of Practice, Code of Ethics and so on. But if they're not a member of Fitness Australia, they operate under their own self-determined code. And again, coming back to the allied health, all being professionals or having a tertiary degree or ongoing development, etc. Correct me if I'm wrong here, but I would imagine most of them operate some sort of regulated framework as well.
Yeah. So there is the APRA regulated professions, and then there's self-regulated professions. So again, I think, you know, consumers are looking for information and some sort of assurance that they are getting quality care, and so I do think that's really important. It's always a balance, I guess, of how you do that. You know, it takes a lot of effort and time and, you know, investment on everybody's behalf. So I'm not an expert on the systems, designing systems to do that, but I think the principle is absolutely the right principle.
Yeah, in a previous life when I was working in early childhood, I was involved with the launch of the Accreditation for early childhood services, and that's basically a regulation model for the early childhood sector. The beauty of that one is that it didn't penalise those that went up to scratch at a given point of time. It provided the opportunity to actually improve, so quality improvement programs and so on. Yes, there were sanctions if you didn't come up to standard, but it was actually the whole program was designed to assist services to get up to standard. Those that didn't were not accredited, obviously. The other thing which is so, I guess, important these days is social media, because parents in early childhood, if they had a bad experience at a kindergarten or a childcare, they were instantaneous to get on the social media, and so that messaging was broadcast very, very quickly. So I guess the takeout I'm getting from your personal observations are that the professional standards are important, ongoing development is important,
Absolutely.
and some type of regulatory framework governance would be valuable as well for our sector.
I think so, yeah. And again, that's not a government position.
No, I understand.
That's just, I think that's the way, in health more generally, people are more and more focused on the quality and the value of healthcare.
Yeah.
And I think, being prepared for that and being in a position where you can demonstrate who are the high quality providers is absolutely, that's the strategic way to approach it, I think. Be on the front foot.
Be on the front foot. I think your observation then, that's not a government position, is 100% right, and that's correct, and you're prefacing your comments on that basis, which I completely understand. The government doesn't have a position on our sector. I think it's beholden of our sector to take a position to the government, and that's what this whole, I guess, appetite for regulation, whatever you want to call it, accreditation is coming from. Because the worst case scenario for us would be if the government sort of decided at some stage to impose regulation on us, taking a model from somewhere else that didn't fit, and then we had to work under something which was not good for our members, the general consumer and so on. So really appreciate your insight and your time. I know you're very pressed with COVID at the moment and everything else. We're all running flat chat, but I really appreciate your time and appreciate your sharing your thoughts with us.
No problems. Thank you very much.